Good afternoon, Mr. Niconi. How are you?
Fine.
I can see that you have prepared a list of questions for me.
Yes, this is what my doctor told me about my prostate.
Okay. Well, I'm here to help answer some of your questions.
What is a prostate and what does it do?
Okay, well, a prostate is part of the male reproductive system. So it's a small gland. It's small and squishy, about the size of a walnut or a ping pong ball. And as you can see, it is located just below the bladder. And it wraps around what we call urethra, that is a passageway of urine or your pee from the bladder all the way out into the penis. So this is where your prostate is located.
What is benign prostate hypertrophy?
Okay, benign prostatic hypertrophy, or also known as BPH, it is a condition where your prostate becomes enlarged. So as you can see, this is the normal prostate right here. This is your bladder, and this is again the passageway or the urethra. So this is normal prostate, and this is what we call an enlarged prostate. So it's a prostate that has gotten bigger. So benign prostatic hypertrophy is this condition where the prostate has become big, and so therefore as it becomes bigger, it blocks the urine or the urine flow because it squeezes the urethra.
Okay. Is BPH a common problem among men?
Unfortunately, yes. As a matter of fact, men your age, between 51 and 60, and I understand you are 59, men experience what we call an enlarged prostate or BPH. And usually men experience enlargement of the prostate early on in life, and it continues throughout his lifetime. So around when you reach like 80 years old, the fact says that around 90% of men around age 80 experiences BPH.
How do I know if I have BPH?
So when you first came to our clinic and you talked to our doctor about some of your symptoms, those are the common symptoms that you would find in BPH. So some of the examples of symptoms would be difficulty when it comes to peeing or urinating. So sometimes you will experience that you start to urinate and then you can't continue, and then you still feel the urge to urinate, or you feel that your bladder is still full. So that's one of the common symptoms. And usually there is also frequency in urination. So you pee a lot, especially at night. The other symptoms that you might experience would be dribbling of the urine. So as you pee, it dribbles. Or you have a weak stream or flow of urine when you pee.
Is BPH cancerous?
So no. So that's the good news about BPH. As its name says, BPH means benign prostatic hypertrophy. The word benign means it's not cancerous. So BPH will not lead to cancer, it's not a cause of cancer, and it's not cancerous.
Okay. How can I make sure that what I have is just BPH and not cancer?
A very good question. As a matter of fact, it's good that you actually see your primary care provider every year. Now that you're 59 years old, it is important for you to have an annual prostate exam. So this is something that providers really encourage their patients to do. And it's not just BPH that's a concern. As a matter of fact, the American Cancer Society recommends that once you reach the age 40 and you have a family history of prostate cancer, especially a first-degree relative, it is important for you to be tested for not just prostate cancer, but also to see if your benign prostatic hypertrophy needs more medical or surgical treatment.
How do you screen or test for BPH?
So one of the things that we will do is to test for a specific protein that only your prostate produces. So this protein is called prostate-specific antigen. So the doctor will see whether the level of your prostate-specific antigen, or PSA, is high or low. So normally, if you have a healthy prostate, your PSA level would be low. If it's high, it can indicate that you may have BPH or some other prostate problem. So that's one. The other common test that we do is what we call digital rectal examination. So to put it simply, when you come in for that procedure, you will be asked to bend over or to um, lay in bed or the stretcher in a curled position. Then your provider will insert a gloved finger, which is lubricated, into your rectum, and the provider will feel your prostate. Usually the provider will see whether there is any abnormality or thickening of the prostate.
Should I start with medications right away once I am diagnosed with BPH?
Depending on how your symptoms are, normally your provider will not immediately put you on medications. So there is that period, what we call watchful waiting, where we just recommend that you monitor the symptoms of your BPH. So in other words, if it's something that's not really bothering you, then you just continue to monitor it. And it will involve probably modifying your lifestyle or your diet or anything like that. So one example is say avoiding too much fluids or not drinking a lot of water before sleeping, or you avoid anything that will irritate the bladder like coffee or alcohol.
If ever I will need medications for my BPH, how do these medications help with my BPH?
Okay, very good question also. So it depends on what the goal is for your prostate, or what the doctor wants to happen or your provider wants to happen when it comes to managing your BPH. There are two classes of medications. So one group of medications is one that will relax your prostate. So once your prostate is relaxed, that will help with your urine flow. The other one, or class of medications, is are medications that will help shrink the prostate, okay, to make it small. So once the prostate shrinks, then that will loosen the flow of urine or improve the urine flow.
Do I need surgery to treat BPH?
Well, not necessarily. Again, it depends on what's going on with you. If you're experiencing really severe symptoms of BPH, like for example, you're not able to pee anymore or at all, you have bleeding, you have frequent infections related to your urinary system, you have kidney damage or stones in your bladder, those are examples of situations where the doctor might recommend surgery. But there are also, it's important for you to know that there are also certain procedures that are non-invasive or less invasive than surgery, and usually it uses laser, light, or ultrasound.
Okay. What are some of the surgical options for BPH?
There's a couple of options or surgical options for BPH, and one of the most commonly recommended procedure is what we call TURP or TURP. So it involves removing a part of your prostate. So the doctor or the surgeon will insert an instrument, and it's usually a lighted instrument with a camera, and it has valves that will help with irrigation of fluid during the procedure. So this instrument also has what we call an electrical wire loop that the surgeon will use in order to remove a part of your prostate. And during the procedure, it will be flushed out through the penis. So it doesn't require any incisions because it's the instrument is just inserted through your penis, and that's it. So just like any other surgical procedure, you will have instructions before and after the surgery. So did you have any other questions?
No. Thank you for enlightening me about my prostate. It's quite time that I need to
Decide on
decide on whether or not to have surgery or no or not, or just monitor my prostate.
You're welcome, Mr. Niconi, and anytime, if you have any questions, you can just give us a call. I know that you can't make a decision right away, but think about it and then monitor your symptoms, because for now, you're not experiencing severe symptoms of BPH. So we would recommend that you just continue to monitor, and then once it gets to a point that your symptoms start to bother you, then we might put you on certain medications. That's what I described earlier. There are different types of medications with different effects. So sometimes we can combine these medications to help with your symptoms. So that's it.
Thank you very much.
You're very welcome. Thank you.